So the main principles that I'm sharing here today are the exact approach that I have used personally for my bone strength and overall health. And it's based on the whole person approach to bone health, which is the functional medicine approach, or like to say, because the approach of functional medicine, the whole person approach, comes I think from ancient Greece. So I like to say like the ancient Greek approach, but you get the message. So it's just the whole body, the whole person, the whole picture that we need to take into account into both for bone health as well. So not for everything else. So bones and a skeleton is not like a separated part um, than the rest of our bodies. And this is what our approach is based on. Why this is important for you now? I mean, I mentioned at the beginning, but I just started recording because being healthy, strong, and active determines our health span and lifespan. So not only how long we live, but also how well we live. I mean, unfortunately, my family has been very much affected by osteoporosis, and I saw this, especially with my mom, from a very young age, since it was 55. Hair mobility and quality of life being a lot more limited because of a spinal fracture, because of the osteoporosis that she had when she was about 55. I'm going to be 55 in 2 years. And the last thing that I want for myself and for you is being in a similar position. So, my mom now is like 5, so like 20 years of her life. She has, she has reduced mobility, and for 20 years now she's not able to use it. And that is really unfortunate, but it is something that can happen, and I don't want it to happen to you. So you're tired and confused of your diagnosis, so this is another reason, and the conflicting advice that is out there. And because most osteoporosis treatments are too generic or have side effects and very few benefits. I think for me, that was the primary driver when I started looking at osteoporosis differently, because I just couldn't accept, because the only thing that I was given when I was diagnosed when I was 32, they didn't ask for me. So they didn't ask for about drivers or the causes, that they didn't care. But doctors were like, oh yeah, take the medication, and these are the side effects, and deal with it. And that was the primary driver for me. But for you, it could be something different. And it is right for you, of course, if you have osteopenia or osteoporosis. Osteopenia is, I would say, the first stage of osteoporosis. These are terms, and the diagnosis are based on numbers and averages that are a bit confusing. As part of my 12-week course, I was, I had like huge section where I was explaining all these, but at the other day, it's not as important what number you are on the osteoporosis scale. Okay, from the moment that you get the diagnosis, or you get a signal from a scan that your bones are weakening, it's important. So going down to the numbers and explaining in a lot of detail is not as important. It's very important to you as well that you have musculoskeletal pain or family history of osteoporosis. And of course, if you want to stay active and healthy for life, it's not for you if you have some rare genetic condition that this is the primary driver of your bone condition. So this is a completely different case scenario, and this workshop, this masterclass does not apply to you. Or if you're looking for some form of a medical treatment, because of course, what I'm doing here is based on my personal journey, is based on my professional training, my clinical experience, the latest understanding of bone health, but it's not a medical treatment. So my goal is to tell you, not to tell you what to do, but to help you making informed decisions about your bone health and health. And let's start with why bone health feels so confusing. Easy. I mean, you just go on, searching on Instagram. As I was, just trying to put this slide together, I was looking on Instagram like different, people that I also respect. Not like every influencer, but people that I also respect. The kind of information that they put out there, and even people that I really respect their work. I could see that they were talking about a lot of like different things together. So calcium, vitamin D, vitamin K2, protein, exercise, collagen, supplements, hormones. Um, Everybody seems to say something different. And I would say what annoys me, especially in the last, well, not annoys me, but it's just becoming very, I think, to the point that it's become a little bit misleading, is the information about hormone replacement therapy and the impact that it has on bones out there. But anyway, what have you, I mean, yeah, I mean, I'm just interested. Use the chat and just tell me what you think that it's the most important, or what have you been told that is the most important. Usually it's calcium, but for exercise, this is the thing that I hear most. But what have you been told that it matters most? It could be something different. So just let me know. It would be interesting to talk about it and even try to explain it even more. Um, and the calcium need. Okay. So, I mean, I just want to clarify here. I'm not anti-calcium. Quite the opposite, of course. You know, calcium is very important for bones. More than 90% of bones are actually from calcium, so it's very, very important. What I don't agree so much is when we focus only on calcium, which is primarily responsible for the bone density, and especially the calcium from supplements. And the majority of the supplements are supplements that are not very well absorbed and utilized, unfortunately. So these are the kind of discernment that we want to make between the two. So not anti-calcium, just reframing absolutely everything. It's not how much calcium you get, it's how much your body can absorb it. And of course, the more that you get it from food, the more bioavailable it's going to be, and not so much from supplements, especially supplements that are calcium carbonate, which in this case, probably the most purely absorbed form of calcium. I remember myself ending up with, in the beginning of my journey, ending up with a lot of calcifications all over my body. Like most, it was like small lumps all over my body that you can actually, actually feel, and sometimes see because it's so big. And still have some of my legs actually from little lumps, calcifications. Some of them, they were very close to the muscle, so they have become quite painful as well. And that was because I was told to take 1,200 milligrams of supplement, supplement the form of calcium. And it was carbonate as well. And it was 1,200 as well as a supplement form, very poorly absorbed. That was not a very good thing. That it was a very good advice. But unfortunately, this is what they needed. Why the traditional conversation is incomplete? Because bone is a living tissue, and bones are metabolically and hormonally active. And I was listening to Dr. von der Wright, who actually I met last September in London, and I agree with a lot of things that she shared. I don't agree so much about some other things, but she's great. I think the kind of information that's put out there and the way that she puts the focus on bones is absolutely great. So I'm grateful for that. And she was also telling me that it's a metabolically and hormonally active bone living tissue. So that means that it's part of your metabolism. So the bone metabolism is part of the whole metabolism, and also not only responds to hormones, but creates its own hormones. And osteocalcin, for example, is one of the most common one. It's very, well, the research now shows that it plays a very important role for brain function and brain health. So it goes beyond bone. It's constantly rebuilding. So whoever told you that you stop building bone the moment you get into menopause, that is wrong. What is changing is the rate. And actually, the rate of the bone starts slowing down in the 30s. So it's constantly rebuilding what's called bone remodeling, and it is affected by the whole body, but also affecting the whole body because it's a metabolic and endocrine organ itself. It's not, our skeleton is not separate. It's part of the whole body. And this is the simplest picture that I have found for you. on the bone remodeling cycle. And so the osteoblast will build bone, the osteoblast will resorb it. That's the old bone that needs to be removed. So that's another thing. Some, for example, bisphosphonates, some medications, they stop uh, bone loss, or this osteoblast action. You don't need to stop it. You need to regulate it, because all bone needs to go away. And of course, you've got hormone and neurotransmitters that don't show in this picture here, that also coordinate communication and signaling and the balance of this resorption and inflammation. So the bone matrix is very complex, and we don't think about. You can see here, we don't think only about the density, which calcium and rest of the minerals are responsible, but also about these little walls and the quality of these walls and structure of these walls. And this is what is very, very, very important, and sometimes is also missed. And calcium, not so much. It doesn't play such a big role in this. So the question is not how do I get more calcium, but what influences bone remodeling? What influences this balance between osteoclast and osteoblast that build bone? And the question, well, the simple question is here. The 4 pillars of strong bones, the 4 fundamentals, the 4 steps, in the simplest form, is nutrition, movement. For nutrition and movement is what we hear more about. And then you have inflammation and metabolism, metabolic issues go together, and mindset and emotional health. And it's these last 2, the inflammation and mindset and emotional health, that are completely forgotten, ignored, or dismissed. And for the majority of people, another thing that I would like to say here is that first thing, we need to understand that except nutrition and movement, we also have inflammation and mindset that play a major role. But each of these pillars and how they're being applied to each one of us may also be different. So there is a lot of more nuance and a lot of more personalization that needs to happen. When you have to do it on your own and looking at social media and research and books and I don't know, whatever else on your own, it can be really, 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 really confusing. And I've been in that phase, especially before I started studying the subject myself. I've been in that place, so I know how you feel. And I'm just going to just share some insights with you, and just please, you can put it in the chat, ask whatever you want. Something that is missed about nutrition that go about calcium, vitamin K2, endless discussions about why NK7, K2 and NK7 form and not NK4 and NK4 form. Why, I don't know, dairy or no dairy. Dairy is the worst that you can do. It's all about inflammation. No, I mean, dairy is the most bioavailable calcium that you can take. And a lot of discussion about that. And with me, especially menopause, you know what I see with most women in menopause, especially if the weight starts creeping up? Calorific insufficiency. They don't eat enough. And if there's not this, if there's not calorific efficiency for the current, your body type and your activity levels, then of course your whole metabolism is going to suffer and your bones are going to suffer as well. So I know this might sound a surprise, but seriously, I think the biggest challenge with the menopausal women that I have worked on, one of the biggest challenges in nutrition, is not calcium, it's not the dairy intolerance, it's not the gluten intolerance, it's actually calorific efficiency. They go on some sort of like crazy diet that they show somewhere on the internet, and they don't eat enough calories. And of course, if you don't eat enough calories, then you end up not eating enough nutrients as well. And your metabolism is not working well, it's slowing down. And guess what? You're not even losing the weight. So this is, one insight that I just want to say about nutrition. And they're missing that. So they go like, religious about calcium and different nutritional plans. And you can't imagine. And then They just don't eat enough. And of course, eating a lot of protein is very, very important. And it's very difficult when you go on crazy diet. You need enough protein. You need 25 to 30 grams of protein. And then on movement, another thing that I see very often, I mean, there's a lot of confusion about what is safe, how much, how often. But what I see again, especially with perimenopausal and menopausal women, is that they start and they just go mad. They just do absolutely everything. And the resistance exercise and the jumps. I saw somewhere like 100 jumps a day. It was like just ridiculous. I mean, but the majority of over 55 plus women to do 100 jumps a day, especially, they haven't done any sort of training before, that don't have the core capacity, and they're going to be destroyed like in 2 days. Anyway, impact exercise, jumps, things like that, resistance training, different methods like Ultra Strong, which is one of the methods that I also use. There's so many things going on there, but what is actually safe for you? And people that just started all together at the same time, and they get overwhelmed and they get injured and they get disappointed, they see no results. And yes, I mean, if there is no recovery in between intense sessions, and some women that do that daily, well, in the beginning, because eventually they get tired or injured and they stop, and then, it's even worse. But recovery is essential for new bone formation. Everyday intense workouts would lead to bone and muscle loss. What happens? The bone goes into catabolic, the body goes into catabolic state, like fight or flight response, and you're just losing your own tissues. You're just eating up your own body, the muscle and bone. And inflammation. When you have another inflammatory condition, autoimmunity, diabetes, and actually diabetes, it is a very known inflammatory condition, but people don't know that diabetes can actually affect your bone, and in a sneaky way, actually, because your bone density may appear still okay, your bone quality not so much. That's because of the kind of inflammation that it happens on the collagen matrix, the protein matrix of the bone. So if you have, but anyway, if you have another condition, it's quite easy to say, oh yeah, my body is inflamed, or if you are in pain, have some sort of like arthritis or something. But what if this is not so obvious? And that's what happens. And actually, the most known inflammatory condition that leads to bone health issues, to osteoporosis, especially in men, I would say, is IBS, irritable bowel syndrome, and actually young men. Every time that a young man came to my, to my practice for help because they have problems with the bone, they were diagnosed as osteopenic or osteoporotic, it was because of that. Saying that, IBS can be major in menopause as well, and menopause itself can trigger IBS because estrogen balance is very much happening by the gut-liver axis, by the gut-liver connection. So when you go into menopause and your whole estrogen balance, rebalance, is just changing completely, one of the first things that happens is IBS, of course, stress that some of the other symptoms can cause you. And this can also impact how you absorb nutrients at gut level, but also at cellular level, because when you absorb from the gut, it go in bloodstream and tap into the cell, the bone, whatever that is. So that's the most common thing that I see on someone that can be a driver, a primary driver for osteoporosis. So what this means, that if someone takes a lot of calcium, they try to optimize the diet, take a lot of calcium, protein, blah, blah, etc. If they still suffer from IBS and they're still not absorbing, it's like they're trying to feel like like a hole, like you try to put something into your bones, and it's just leaking from your gut, because it's like literally leaking from your gut. It's not going where it's supposed to be. And mindset and emotional health. I mean, usually we think about mindset and emotional health having an effect on our behavior or how we eat, how we sleep. And this, of course, is going to impact the nutrient absorption, for example, which is very important, especially for minerals, not only calcium, but minerals, mineralization for our bone density and bone strength. But bone, now we know that responds directly to serotonin and other mood-regulated hormones and neurotransmitters. There are hormone and neurotransmitter receptors on the bone itself, which means that depression and the changes that happen in your body and neurotransmitters because of that has a direct impact on your bone. Direct impact, not only the behavior, and the behavior has an impact, but a direct impact on how the bone is behaving. Remember what I said in the beginning, that bone is a neuroendocrine organ itself. So it responds to hormones, but also creates. And of course, antidepressants, because they kind of like mess with this balance. Long-term use of antidepressants can have, now that we know that, can have direct impact on bone. So we can see, I have the best picture that I could think about is a puzzle. So bone health is a puzzle. And the thing is, what's the missing piece for you? And sometimes it's not the calcium. And sometimes it's not the exercise. Or sometimes, yes, it is the exercise, but it is a bit of exercise that is actually best for you, and not, putting the weight test and do a lot of walking, but actually balance or stretching. Actually, these are some of the things that were very important because a lot of the fractures that I had in the past, that's how I was diagnosed in the first place in my 30s, because I used to have a lot of fractures very easily. It was because of my bad balance. I had quite a lot of falls. Of course, in my 30s, I shouldn't, it wasn't normal to just fall from a height and just have a fracture. And this is the reason that, the doctors were alarmed and sent for a bone scan, thank God. But yeah, I mean, it was very important. The balance was not good. And the good news, you don't need to do everything. And that's the focus of the conversation here. You just need to understand where to focus. And what I was working in the last year or over a year now, that's what I'm doing with my one-to-one program. The personalization. I put the test in. I do, absolutely everything, assessments, blah, blah. And I'm very scientific still, so I use a lot of tests in my personal life program. But how to do that when you're on your own? Because, my programs are 6 months. Sometimes they can last longer. And especially if you add the testing, and I do use genetic testing as well for personalization, they cost quite a bit of money. And not everyone can invest that time and that money. So what are you doing with those people? So I was just trying to find a way how I can share my knowledge and experience in a kind of like still effective but broader way that can be helpful, and to avoid the overwhelm. So for people to understand, to still build the plan that they can follow without needing 6 months, without needing tests. I'm not saying that it's going to be as good as doing the whole thing, but actually it can be very, very powerful, because when you do start with a plan that is clear and is not overwhelming, you can see a lot of improvements even in the first 12 weeks in how you feel in your own body, first of all. And then, of course, this are going to be reflected on everything else. And that's why some people improve and some don't, because you might get the same diagnosis but different missing pieces. And sometimes, like I said, you don't know what the missing pieces are. You're just trying to do everything on your own. And it's nightmare. I remember myself in the beginning of my journey having numerous different Excel spreadsheets, me, the scientist, and just keeping a record, OCD, obsessive compulsive disorder, whatever you want to call it, keeping records what I was doing and what I was eating and how much protein and how much supplements that I've changed and what the symptoms are and if I had any symptoms. And yeah. And believe me, I've had clients in the past that were similar. And you can, yeah, if I guess if you do like to do this sort of thing, yes. I mean, some people get like completely power confused and very demoralized. So the four pillars matter: nutrition, movement, mindset, and inflammation. But they're not the whole story. Not everyone needs to focus on the same thing at the same time. We need to prioritize, to start doing with the most important thing for you, and then keep in order. And when you start doing with the missing piece, then everything else starts improving as well. But it's very important to start with what is most important. So tomorrow we're going to talk a little bit more about that and how, especially women, focuses on women today, why some women do everything right and still struggle. And this is going to be explained when we talk about hidden bone things. Like, so they're very much hidden elements or factors, usually within the inflammation and mindset pillars that are being used. So this is going to happen tomorrow. And that's what I wanted to say for today. And yeah, I mean, stop sharing the screen now. So do you have any questions from today? I try to keep it as simple as possible, but hopefully I managed to get in all people that were trying to get in. At some point, I couldn't see what was happening with Zoom, but anyway, at least they received the recording. So do you have any questions from today? Is there anything in particular that you didn't know, you haven't heard of, or something that you heard of and you need to know more about? You still have time.
Oh, hello. Can you hear me? I'm Anna.
Hi, Anna.
Oh, yeah. Hello. I've just got one question. How important is bone collagen from supplements to use with the K? Because I'm taking a food-derived calcium, and that's got vitamin D3, magnesium, and the K, the Miniquine K7, whatever it's called. And then bone collagen, I think there's like 1 to 6. And they say that number 1 and 3 are specifically to build the bones. Now, is that important to take?
You mean for the bone type? Look, the bone itself, and this is something, I mean, first of all, collagen supplements, they can be very helpful because they help with the bone quality, as you mentioned. But
Yeah.
the types that are necessary for the bone are a lot of different types. The bone needs a lot of different types. So what I recommend to people, and again, a collagen supplement in itself, if you have other problems, for example, with inflammation, it's not going to solve the issue.
Yeah.
But what I say to people, if you use collagen supplements, I use collagen supplements as well, try to alternate and use as many different types as you can. The reason why is because bone is a quite complex structure and it uses a lot of different types, primarily type 1 and type 3, but also type 2, type 10 as well. So if you can find a multi-collagen formula that is pure, it doesn't have any nasty bleed, then it's probably the best that you can do. But also alternate, because multi-collagen types formula sometimes they don't, they don't have enough of the type 1 and type 3 that you need. Type 2 is important for joints, so not for bone formation. So that's another thing. So for example, I like to use, I use a lot of different, it's not only one for myself. And depending on the person as well, on when they need focus, I also recommend different subtypes. For example, if someone has IBS, that I mentioned before.
Yeah. I'm hypermobile.
Sorry?
I'm hypermobile, so I'm just wondering, and I also have celiac disease, so I'm still struggling with nutrition and
Okay,
uh,
yeah. I feel you, my dear. I absolutely feel you. In this
uh,
case, you really need a lot more personalized approach. And the plan that I will be sharing with you over the next 2 3 days can help you, especially in regards of the information. But you have you have to be a little bit more careful. So, but
yeah.
with collagen supplement as well, you have to be very careful.
Mm,
I wouldn't over use them. I would only use them occasionally, and I would focus on type 1, type 3 only. But with being hyper mobile, I would use them occasionally and not all the time. I'm hyper mobile.
okay, okay. Thank you. Thanks very much.
Well, that's okay. But yeah, again, if you alternate, I think it's the best because that's both
Yeah,
ways.
yeah,
And something else, in my social media, and I explain this very 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 well in my programs as well. There are different types of collagen, not only types, but in terms of sources. So you have the
mm,
marine collagen, you have the bovine collagen, and you have the chicken collagen. Chicken
yeah.
is mainly it's for joints, so it's not so much for formation.
Mm,
Um, and then you have type 1 and type 3 from coming from marine or from bovine. Bovine is more bioavailable.
mm,
Marine can be a little bit better for your gut or your skin, not for your bones. But if you have
yeah.
absorption issues, then marine can be a little better. So really,
Mm, yeah. Okay, I'll experiment. Thank you.
yeah, be very careful and not overdose. Especially if you are hypermobile, don't overdose. Keep it on
Okay.
smaller, smaller doses.
Yeah, I think 5 grams. I'm taking 5 grams,
Yeah,
which
keep
isn't a lot. That's still
no,
minimal, isn't it?
it's not. It's the minimum, exactly. It's the minimum.
Mm, okay.
If it is good quality and you don't take it every day, you have big breaks, you could probably
Mm,
go up to 20, but
mm.
not if you do it every day. I wouldn't recommend
Yeah, yeah. Okay, okay. Thank you. Thanks very
that.
much.
Anything else? I mean, this is the kind of support that it's very difficult to get if you don't work with someone on one to one. And this is the
Mm,
reason why I come to meeting this. And I mean, the slides were just like for introduction, but actually to start the conversation and bring that for that sort of personalization and support to
mm,
in a group setting. And again, it can't be like a huge setting. I think I had like over almost like 200 registrations to be
mhm.
here live with us, to be honest. But I mean, a group that it's manageable and not like thousands of followers on social media and doing live. Absolutely great, and I'm doing them. I absolutely love them. But it's very difficult to get that sort of level of support and structure in that sense.
Mm,
So the best step, the next step for me is actually do it in a group setting. Because the one-to-one is something that is not accessible for everyone. And for some,
mm,
it can be very overwhelming. I mean, with the majority of my
mm.
clients that I work on one-to-ones, it's 6 months work. And it's a lot if someone feels
Yeah.
overwhelmed already. So, any other questions, please?
I've got one more. If no one else has a question, it could be relevant to everyone, possibly. Can I ask it?
Yeah, go
If
for
no
it.
if no one else has a question, I don't want to kind of take over. Just wondering, HRT I was offered because my DEXA scan was worse than about a year ago, but my absorption issues are a bit better. So I'm hoping that my third DEXA scan in a year's time will be better. But I was tempted to take HRT because then that would help because my estrogen, I'm 52 and my estrogen is like non-existent.
Which is
So obviously if I took HRT,
better.
Yeah, I mean, 52 is, yeah, I mean, I'm still not that old. So I would hope that I'd have a little bit. But yes, with HRT, I was told that it would help my estrogen, which would automatically also help your bones. So, but I don't really want to take because I'm quite alternative. So what would you recommend? Like, at what point does one take HRT?
The HRT, body identical, they call it in UK, or bioidentical, which is not, it's not a standardized term. That is a term that is used internationally. It can be helpful for bone health when there is the transition into menopause. So the first 5 to 7 years.
Mm.
Not for absolutely again everyone. I would strongly recommend to do a very a very close checkup with what happens with your heart health,
Mm.
certain scans on your arteries, just to make sure that there's not any issues there before you try stunning. But if that's the only, it can help, not
Mm.
massively when you are doing that transition. If
Mm.
added much later, then the benefits are minimal or zero, and actually for some women
Oh.
even be detrimental, especially on their brain. I
Mm.
know it's different to what is out there. Estrogen is absolutely great for preventive treatments and everything, but when you add it into your as an HRT, like
Mm.
much later in life, up to 6 days, then it can actually have the opposite effect. That's what
Mm.
starts showing now. So it's very much time sensitive, and it's very much if you have to do like certain tests, making sure that there's not any other heart conditions that
Mm.
can be triggered. If
Yeah.
you still if you're still menstruating or have been menstruating until recently, yeah, you might try
Yeah.
and
I
see.
know I haven't actually, maybe probably for about 4 or 5 years, I haven't really had a proper period because of my, well, undiagnosed celiac disease. I was only diagnosed a couple of years ago. So, yeah. And in fact, when I went to see my parents abroad in Croatia, I was eating much less pasta because I got an Italian partner. And when I went over there, I would get my period literally within like days, well, weeks, maybe a week or so of getting there because I just wasn't eating pasta. I'm sure it was that. I can't think of any other
It
reason.
could be because when it was just making your gut a lot more inflammatory, so you couldn't
Yeah.
absorb nutrients, and the most affected nutrients that from inflammation in the gut, inflammation, general inflammation in the gut, at gut level, is minerals.
Mm.
Vitamins can survive inflammation quite a
Mm.
lot, especially if they're not lipophilic. So lipophilic vitamins, vitamin A, vitamin K, vitamin E, vitamin A. So vitamin, in general, vitamins are much stronger and resilient, but minerals not so much. So
Yeah.
first thing that you start missing is minerals. And actually, another mineral that's fully absorbed if you are celiac, iodine. Guess what? Iodine is very important for thyroid. Guess what?
Mm.
Thyroid is your master gland. And if your thyroid is not working properly, and that was an issue that I had, I was
Mm.
extremely iodine deficient. The primary driver of one of my biggest drivers of my bone loss at 32 was my thyroid.
Mm.
It's like crazy.
Mm.
Um, so yeah, I don't know why I did that. But yeah, so it's very very important to do that, and
Mm.
I'm glad that you pointed that out. But celiac sometimes think that people with celiac they think that they will have a lot of obvious symptoms, but they're not. As in your case, it was missed until your 50s, right?
Mm. Yeah.
Something. So sometimes, and that happens a lot with men again, but also with women, you don't really have any symptoms, or you have symptoms that are more neurological than
Mm.
gut symptoms, and
Yeah.
you're like, okay, maybe it's me being stressed, or and it's
Mm.
actually your celiac. You
Yeah.
have like palpitations, and you go like,
Yeah.
it's because of stress.
Yeah.
This is
I was a bit hyper and I lost lots of
exactly,
weight. That was
and
mainly.
because you were not absorbing. But
Mm.
actually, a lot of celiacs have these like singular manifestations of their celiac disease, and they don't find out until they find
I
it's
know. Yeah, it's mad. Oh,
so
thank you.
that's okay. Let me see. I think there are some more in the chat. Calcium. Calcium Madoco is using formal medication. Deborah. Yes, I know, Deborah. That's what they did with me, and I just couldn't accept it. I was like a crazy scientist in my case. I was like, yeah, I'm going to figure it out. And saying that medication in some cases can be very helpful, especially when there is a very accelerated loss. It can put the brake on, okay? But if you don't address any other factors, then it starts becoming a problem, especially by phosphonates. Because remember, if you join at the beginning by phosphonates like Fosamax, for example, Reclass or Aclasta, depending on what country you're coming from, different names, which is the infusion form of biphosphonate. They actually almost stop bone loss, and we need to lose the old bone. If you have this medication for a very long time and you're not doing anything nutritionally and for your minds and for your inflammation and everything else, then it's not going to be helpful. But in the beginning, it might be helpful if you lose it bone very, very quickly. So again, it's not a black or white approach. And actually, I work with a lot of women and men, but particularly women, that have medication at the same time. And sometimes it's required. But having a medication is not solving the other problems. So you really have to work with the other problems at the same time. And another thing with the medication is none of these medications, but none of them has great results. They have side effects. And because of side effects, you cannot use them for a very long time. The Forteo, for example, I think it's 12 months to up to 2 years, the maximum. It's an anabolic form, so it actually builds bone, but it has massive side effects. Biphosphonates, maximum 3 to 5 years. And a few years ago, I actually have a friend of mine, she's in her 60s now. Now she's a yoga instructor. That's how I met her. She started using biphosphonates in her 30s because she had early menopause. She had computers anyway. It was like a complicated case. So she went to early menopause, and that's why she had osteoporosis in her 30s. And she was put on biphosphonate. Back then, there wasn't this research. So she was on biphosphonate for over 15 years. And her bones, her jaw was like completely destroyed because that's like a big structure that gets very much affected by biphosphonate. So she had, I think, 3 or 4 different surgeries just to completely fix this because she was poor thing of 15 years on biphosphonate. Back then, they didn't know. They didn't have all the factors they have now. But thank God now they know. So they even tell you, you need to stop after 4 years, and they monitor you for that. So thank God this is happening. I believe food is better, and we gave up calcium supplement. Yes, Deborah. I don't know where you're based. If you're based in the States, there is a calcium. Actually, it's not really a supplement. It's more like a food-based supplement. By seeing the nutrition, it's called calcium chew, and this is probably the only calcium supplement that I can safely recommend to everyone. In some cases, especially if someone has to exclude dairy completely, I can say take some calcium supplements, but very rarely. I don't take calcium supplements myself, only very rarely, sometimes when I fast, because I do fast, I do some fasting 2, twice, 3 times a year, depending. But in general, yeah. Reggie, I can't wait to learn more. Thank you. I'm very interested in tomorrow. Yes, tomorrow it's could be very important. Sorry, I talk a lot. I get very excited about these things. Tomorrow we're going to talk about the hidden things. Interested to hear more about inflammation. I have migraines and wondering if these are impacting bone health. Well, we need to find that's Julia. Julia, what is the cause of the migraines? I mean, I have migraines sometimes, but I know in my case it's because of my scoliosis, so it's purely muscular. But migraines, which of course could be a sign of inflammation, could be because of something else, could be even a deficiency. I mean, first thing that I'm thinking about deficiency is iron and B12, for example. So there's a lot of things that could, could be impacting that. Um, yes, alternating collagen, Deborah. As you switch from article to orgain. Article, actually the collagen is not too bad, I think. But some of the other supplements that have strontium in, they're not so good. I think someone has their microphone on. Let's see if I can change that. Okay, thank you very much for this. Still trying to figure out how to work with Zoom now that everything's changed. So algical strontium, the strontium algical product is something that I would recommend because strontium can actually displace calcium from your bones, and strontium is not supposed to be part of your bones anyway. It can make them denser, but not necessarily stronger. And if you go on the social media, there is like a whole, I think, a lecture. I think I also have it on YouTube. I don't remember, but definitely on Instagram that I explain about what is wrong with calcium. Interested in vegan options for calcium, protein, and collagen. Who's that? I don't have your name. Well, for vegans, we need, I'm not a vegan, but sometimes I go through periods of time that I go on a vegan diet just because, for change things and not being bored. For vegans, if you go on my profile, Facebook, Instagram, I don't know where you find me. You can actually go on a link there and download some information about that. If you have to avoid dairy, and that's vegan and dairy-free friendly, so there you can do that. Collagen, my dear, is not vegan, but so collagen itself is not vegan. It's an animal source. So if you are a vegan, the best that you can do to fix that is get collagen peptides with a vegan from a vegan source that are separate, so they're not as bioactive, so separately as part of a powder. And of course, increase your vegan vegetarian protein in your food, and make sure that your digestion is as good as possible so you can digest the protein, because not being able to digest the protein is the worst idea that can happen. The worst bloating and the worst gas as well. It's actually from protein. It's not from carbs. It's a process. It's the putrefaction of protein. It just gives you like this very bad smelly parts that don't work out. So, and it's very uncomfortable. It can cause me a lot of pain as well. Thank you, Sonia. How do you know if you have inflammation? Thank you very much for that. Well, sometimes it's obvious and sometimes it's not so obvious, but we're going to talk about this tomorrow. So if you want to join tomorrow, we're going to discuss about that. There are some basic inflammation markers like CRP, for example, that you can test in the blood test. But these markers for these markers to be out of range, you really need to be very inflamed. And the kind of inflammation that is missed is not being picked up by these bone markers. So it's quite hidden. But we're going to talk about this tomorrow. Interested here. Let's see. Anything else? Yeah, I think that's all about today. So thank you very much for everyone that has joined us today. Tomorrow, I probably missed a few people from the waiting room. Sorry. So hello, we're just finishing today. Thank you, Julia. Thanks, everyone. If somebody joined later today, please join us tomorrow. I had a little bit of a problem with Zoom today to let people in on time. So please join us tomorrow. You're going to receive an email later with the recording. Tomorrow we're going to talk a little bit more about, a lot more about inflammation and the hidden thieves of our bones and what cause bone loss we don't know about. So please join me tomorrow at the same time. That's 1 p.m. for that's New York time, so Eastern time. 8 p.m. for Greece. Everybody is joining from Greece. I can't tell. And 7 p.m. CET, 6 p.m. UK from everyone that's joining from the UK, and 7 p.m. from the rest of Europe except Greece, 8 p.m. So see you tomorrow. And yeah, thank you very much. And sorry about the late start today. Bye. Bye-bye. See you tomorrow. Bye.